The LDN Book Volume Two, the latest research on how low-dose naltrexone could revolutionise treatment for post-traumatic stress disorder, pain, irritable bowel disease, Lyme disease, dermatological conditions and more. A comprehensive examination of low-dose naltrexone, a little-known drug with big potential. A drug that is simultaneously affordable, devoid of severe side effects and applicable to a wide range of diseases is one not often found in the modern pharmaceutical landscape. But as medical professionals and researchers alike have found, low-dose naltrexone, LDN, boasts this remarkable combination. LDN, originally prescribed in higher doses as a treatment for opioid addiction, works by blocking opioid receptors, thereby stimulating the production of endorphins, mitigating the inflammatory process and stabilizing the immune response. Prescribed off-label and administered in small daily doses, this generic drug has proven useful in treating many different ailments. Expanding on the information presented in the LDN Book Volume 1, which showcased LDN's efficacy in treating conditions such as lupus, thyroiditis, autumn spectrum disorder and chronic fatigue. Volume 2 highlights the latest clinical trials, case studies and research on LDN. More than a dozen medical professionals explain how they are using LDN to help patients suffering from chronic pain, Parkinson's disease, dermatological conditions, traumatic brain injury, Lyme disease and more. The LDN Book Volume 2 is both a resource for practitioners, pharmacists and patients, and a renewed call for further research on the healing potential of this generic drug.
My name is Dr. Phil Boyle. I am an LDN prescriber for over 15 years. This book is packed full of new information covering areas not included in the first LDN book, which has been a huge success. It explains clinical experience of new areas not previously covered and also looks at recent publications, the most up-to-date publications available about low-dose naltrexone. This is a fantastic addition to the growing well of knowledge about LDN in clinical practice and published experience. So I very much look forward to many people reading this book and adding it right beside the first LDN book as additional useful clinical information.
My name is Stephen Dixon. I wrote the first chapter for the LDN book, entitled The History and Pharmacology of LDN. I've been dispensing LDN as a community pharmacist for over 15 years. The aim of the first chapter is to give a novice reader a bit of a feeling for where LDN comes from and how we ended up using it as we do, but also for medical professionals to start to understand the rationale behind prescribing LDN, especially for the myriad of diseases that we do so. With a baseline understanding presented in Chapter 1 and clear references, readers are primed to better understand the context of the rest of the book. If readers want to get in touch with me direct about this chapter, please visit our webpage www.dicksonchemist, that's D-I-C-K-S-O-N, chemist.co.uk.
I'm Dr. Sarah Zielsdorf, a contributor to the LDN Book 2. I'm a co-author of the chronic pain chapter. Chronic pain is a leading cause of disability and disease burden worldwide. It is a health crisis. It is pervasive across populations and heavily impacts physical and emotional life. There is a strong dissatisfaction with treatment paradigms and the standard of care of chronic pain management. Low-dose naltrexone represents a completely different strategy. There is little awareness that by briefly blocking the opioid receptor, we can achieve pain relief and target the underlying chronic inflammation at the heart of such conditions as chronic regional pain syndrome, neuropathic pain, autoimmune and rheumatologic diseases, multiple sclerosis, myofascial pain, fibromyalgia, and even endometriosis.
This is Neil Mehta, pain specialist and anesthesiologist in New York City at Weill Cornell Medical Center, New York Presbyterian Hospital, and one of the co-authors of the LDN book chapter on pain management. You will find LDN has a long history for usage in pain, and it has been really of interest in the past couple of years. In this chapter, you'll see a great detail of description of its application and the associated studies of support using LDN for chronic pain.
Hello, I'm Leonard Weinstock, gastroenterologist and a physician in St. Louis, Missouri. I was privileged to ask to be the author of Gut Health, which is a chapter that deals with low-dose naltrexone in a variety of areas of the GI tract. So gastrointestinal diseases and disorders are things that I deal with every day. And since 2005, when I became aware of LDN, I started applying it to more and more diseases that were untreatable or were treatable, but with drugs that just had side effects or poor outcome. So this has been so interesting over the years to look at the publications. And in this chapter, I looked at the publications in the literature, and I looked at my own personal experience, much of which I've accumulated over the years, to highlight the efficacy of this interesting modality. And I expand on what was written on the chapter in Book 1 on inflammatory bowel disease, and I deal with things that I've seen in irritable bowel syndrome, something totally unheard of, namely mast cell activation syndrome. For many, people are not aware of this really common, significant problem. I looked at my experience in sarcoidosis and people who have published in mesenteric paniculitis, which is inflammation of the mesenteric components of the gastrointestinal tract. So basically the structures that hold the intestines in place and carry blood vessels with it. So there's so many new things out here in this chapter that has not been discussed in any other chapter. And that's why I'm pretty excited about it. And I hope it will be something that either gastroenterologists will read, or perhaps those who suffer from it will have a easy source to perhaps copy and bring to hopefully an open-minded physician who they're being taken care of. And the privilege of being asked to write this chapter, I have to really give Linda Elzegood a pat on her back because she's worked so hard. And I think this is going to be an exciting book and a second edition to the LDN book. So I hope it's readable and that you enjoy it and that something good comes of it. Thank you.
Hi, I'm Apple Bodemer. I'm a dermatologist, and I wrote the chapter in the LDN book about dermatology and low-dose naltrexone. In it, you'll find a lot of information about how low-dose naltrexone can be used to treat a variety of skin conditions, including psoriasis, hair loss, and other autoimmune diseases. I've looked through all of the literature available, about low-dose naltrexone and skin disease, and have included that in the chapter as well.
I'm Dr. Kirsten Singler, naturopathic doctor, and I wrote the chapter on Parkinson's disease. This chapter covers the history, mechanism, research, and treatments for Parkinson's, with a special emphasis on naturopathic or functional approach to care. Additionally, I describe the progress and therapies used for a particularly progressed Parkinson's patient that was under my care for about a year. And hopefully, this chapter helps patients and their loved ones understand the latest research and naturopathic options so that they can find leverage in their care with their doctors. This chapter was a sincere labor of love, and I'm glad to have the opportunity to contribute to the LDN library.
Hi, this is Dr. Vivian Denise, author of the chapter Pediatric Uses of Low-Dose Naltrexone in the exciting new LDN Book Two. Within the chapter, I share with the reader the great strides I have personally experienced utilizing low-dose naltrexone in autistic children and the tremendous, consistent impact it has on unleashing their verbal abilities. I also discuss the etiology and treatment for children and adolescents that have been diagnosed with the pediatric autoimmune neuropsychiatric disorder, also known as PANS and PANDAS, with emphasis on the role low-dose naltrexone plays in their recovery. Additionally, with anxiety skyrocketing in our children and young adult population, I present the use of low-dose naltrexone as a first-line safe treatment option. And lastly, severe fatigue is of epidemic proportion in this group, and in my opinion, severely ignored by the medical community. I delve into the causes and healthy solutions to address these issues so that we may prevent a generation riddled with disease. Please join me for new options for some old and not so old disorders of the pediatric population.
Hi, my name is Dr. Olga Cortez, and I am the author of the chapter on the use of LDN in women's health. I think this book coming out is really exciting. Low-dose naltrexone is gaining so much traction in all areas and all aspects of health, but especially in women's health. I think any time that you can increase the options that women have for treatment options of various conditions, it's a win for the patient and it's a win for the society. And I'm so happy and excited that more physicians and more clinicians are learning about low-dose naltrexone and discovering all the different facets of medicine that can benefit from the use of low-dose naltrexone. And in my chapter specifically, we address women's health, endometriosis, PCOS, really chronic pelvic pain, recurrent inflammation. And so, again, very exciting time, very exciting book. I'm happy to be a part of it and hope you enjoy it.
I'm Dr. Sarah Zielsdorf, a contributor to the LDN Book Two. I'm the author of the Traumatic Brain Injury chapter. Medicine is fraught with misconception about traumatic brain injury, previously known as concussion. Knowledge is rapidly expanding regarding TBI. The majority of TBIs are untreated, a leading cause of death and disability. There is concern for mild head injuries that cause a myriad of symptoms. A proportion of patients do not recover this post-concussion syndrome. In this chapter, I will discuss the mechanisms for the activation of chronic inflammation and immune system dysregulation, and how a little-known generic medicine, LDN, can powerfully address it.
I am Wiebke Pape from Germany. I wrote the chapter Dissociative Disorders. I am a physician and a psychotherapist working in a department of trauma-related disorders, which is part of a hospital treating psychosomatic disorders. The patients with complex PTSD we treat mostly suffer from severe dissociative symptoms, which are generally treated by psychotherapy, which is a difficult and slow-moving piece of work, and there is hardly any pharmacologic strategy that is constantly recommended to support this therapeutic process. In my department, we made experiences with LDN as a supportive medication for 10 years now, and it showed to be a very helpful element in the treatment. In my chapter, I will explain dissociation as a formerly protective mechanism while experiencing trauma, which became a huge impairment in everyday life of traumatized people. I will describe the goals and challenges of therapy and focus on the change that can be observed under medication with LDN. In case reports, you will be able to look closely at the various effects that may occur due to the medication with LDN, and you can listen to my clients describing the perception of this to get a feeling for dissociative symptoms and the change that LDN can bring. And I try to make you see what is new and special about LDN compared to other medications.
My name is Galen Forster. I'm a licensed professional counselor and the co-author with Ulrich Lanius of the chapter LDN and Post-Traumatic Stress Disorder. I'm excited for this opportunity to share what our clinical experience and review of relevant literature has taught us about the remarkable utility of using LDN to treat PTSD, complex PTSD, and other trauma stress disorders. While there is abundant anecdotal references to LDN supporting improved mental health function, scientifically, this is unexplored territory. In this chapter, we provide an introduction to the neurobiology of complex PTSD and other trauma stress reactions with an emphasis on the role of dissociation, developmental and attachment trauma, and the endogenous opioid system. We share what we have learned about dosing and the imperative of using multiple daytime doses for maximum effectiveness. We provide information about dissociation and affect phobia and how to navigate these difficult issues, which, if ignored, may sabotage effective use of LDN and probably account for a large percentage of cases where LDN appears to be poorly tolerated. We share a variety of case studies highlighting how LDN provides essentially side effect-free PTSD treatment with benefits unmatched by conventional pharmaceuticals, such as reduced intrusion of traumatic memory, better focus, increased emotional awareness and stability, reduced ruminating and hypervigilance, decreased anger, improved self-regulation, and a greater capacity for mindfulness. We then summarize our findings and call for further research into yet another exciting application for LDN treatment.
Hi, I'm Dr. Darren Ingalls. I'm a naturopathic physician, and I am the author on the chapter on using LDN in Lyme disease. Lyme disease is the fastest growing infectious disease in the world and affects millions of people worldwide. And although we think of Lyme disease as an infection, what most people don't realize is that Lyme disease has the capacity to actually trigger an autoimmune problem. And this autoimmune problem for so many people can actually cause many of the symptoms that we associate with Lyme disease, including joint pain and headaches and brain fogs and things of that nature. So the use of LDN has actually become very important in actually helping us manage Lyme cases because we have a way of helping modulate that immune reaction to the infection itself. So much effort gets put into treating the infection, and we often don't talk about the ramifications of what's actually happening to someone's immune system when they have Lyme disease or some other type of tick-borne illness. So in this chapter, I explore with you how you can use low-dose naltrexone as an effective tool to really help manage, Lyme disease and control the immune system in a more effective and efficient way that's also very safe and cost-effective for patients. So I'm hoping you'll join us, read the chapter on Lyme disease and low-dose naltrexone, and you'll be able to understand how this becomes such an important tool in the effective treatment of Lyme disease.
Hi, my name is Dr. Jill Cattell, and I wrote the epilogue for the new LDN book being released by the LDN Research Trust led by Linda Elsgood. In my chapter, I talk about my previous experience with using LDN in a private practice setting and how I had the opportunity to see many patients with rare, unusual health conditions. I also talk about the experience I'm having with LDN in my new practice, which is in a free and charitable clinic in my new home state of Virginia. I've always recognized that my LDN patients are fighters. My previous patients fighting to find answers for their health, and now my new patients fighting difficult life circumstances. I wasn't sure how well LDN would work in patients in a free clinic setting where you really can't do all the things you would normally do from an integrative medicine standpoint. But I've been treating some patients now for chronic pain and have been pleasantly surprised with the results. So get the book today and get ready to learn and discover more about LDN and all the ways it can help patients and providers. You won't be disappointed.
I'm Dr. Sarah Zielsdorf, and I wrote the appendix dosing protocols in this new LDN Book 2. In the last 6 years of low-dose naltrexone clinical work, both in research and prescribing it, there is much that has changed with respect to dosing. We have more data and more clinicians using LDN for different indications. In this chapter, I seek to unite the current knowledge of LDN dosing, timing, drug compatibility, and special considerations.